الثنتين مع بعض، مثلا نحط الكاميرا هيك على جنب. Assalamu alaikum. Good evening. This is Dr. Ayman Al-Hattab, and thank you for joining online. We will start the presentation at 7:30, inshallah. Okay, so 14 minutes from now, we will start. Thank you. Yes. Assalamu alaikum and welcome. And yes, welcome for our physical attendees. And we have around 500 people online. So yes, welcome everyone. This is the first meeting for MENA Rare Disease Club, where we will have once or twice a month a meeting to discuss a disease or a group of rare diseases. The meeting will be always hybrid, physical and virtual, and we will conduct it in different places. In Dubai, Al Ain, Abu Dhabi, or any other city. So so this is the very first meeting, and we should thank Sanofi to sponsor and support this meeting. And the topic that we will discuss today is Gaucher disease, and with particular emphasis on hematological manifestations. My name is Ayman Al-Khattab. I'm a consultant clinical genetics and professor at College of Medicine, University of Sharjah. I'm also the chairman of MENA Congress for Rare Diseases that the third cycle will take place in Abu Dhabi in May 2024. And I'll be happy to discuss over the coming maybe 30 minutes, the Gaucher disease and the clinical manifestations, diagnosis, and the treatment. And after that, we will have time for discussion. For our virtual attendees, please type your questions in the Q&A boxes, and when we finish the meeting, we will answer them, inshallah. Okay, so we'll start. Okay, so we will start by like a brief introduction about epidemiology and genetics of Gaucher disease, pathophysiology, and then we'll talk about like the classification, different types of Gaucher disease, clinical manifestations and complications, differential diagnosis, and then what are the tests that we do to diagnose the disease, and finally we'll talk about enzyme replacement therapy. So epidemiology. So first, most of us know that Gaucher disease is the commonest lysosomal storage disease. And in general, it's a progressive, heterogeneous, multi-system disorder that can lead to severe complications. It is an autosomal recessive, as we will see in the next slide. And the cause is a deficiency in the enzyme acid beta glucosidase. And this enzyme has different names. So also we can call it glucocerebrosidase or glucosyl ceramidase. It's the same enzyme. And the main pathophysiology is the inability of the body to break down the glucosyl ceramide that will accumulate in macrophages in different organ system. And you can close the door, yes. Yes, thank you. And this accumulation will result in all clinical manifestations that we will discuss in details. So as I said, it's autosomal recessive disease. If we have to have an affected person, both parents should be carriers, because we have like 2 copies of every gene. So if we have one mutation in 1 copy, then that person is considered carrier. So the father should be a carrier, the mother should be carrier, and then the chance of having an affected child is 25% with each pregnancy. Now, this is important because recessive diseases are more common in populations where we have high consanguinity rate. So like in our region, we have higher rates of recessive diseases. Now, prevalence varies widely. So like if you look at gene reviews, it varies between 1 in 4,000 to 1 in 200,000. But like rough estimate is, let's say it's about 1 in 50,000. So it's considered a rare disease. It is pan-ethnic, can happen in all ethnicities and populations, but it's more prevalent in Ashkenazi, with prevalence in 1 in 850. We have 4 mutations listed here. They are the common mutations in causing Gaucher disease, and they are in the gene GPA, the gene encodes for acid beta glucosidase. And these 4 mutations account for about 50% of mutations and 80 to 90% of mutations in Ashkenazi population. Now, as we will talk in next slides, the phenotype is very variable. Gaucher disease can be very severe with a prenatal onset disease leading to hydrops, and can be very mild with adult onset manifestations. And there is no really clear genotype-phenotype correlation. We don't have, there is like considerable overlap between different genotypes. Now, the pathophysiology, we have the enzyme acid beta glucosidase that breaks down the glucosyl ceramide, and it comes from, the glucosyl ceramides come from different metabolic products like the cell membranes. Typically, glucosyl ceramide is broken down into ceramide and glucose by this enzyme. So if we have deficiency in the beta glucosidase, then glucosyl ceramide will accumulate, and will accumulate in macrophages. So the accumulation will in the monocyte macrophage system, or the reticuloendothelial system that is present in multiple organs. So this will lead to multi-organ dysfunction. So if we start, for example, with bone marrow, then we have accumulation of these cells and bone marrow failure, which explains, for example, the cytopenia. Also, these macrophages are present in spleen, so this will result in hypersplenomegaly, and splenomegaly also will participate in the cytopenia. Liver, Kupffer cells also will are the macrophages in liver. They are called Kupffer cells, and this will result in hepatomegaly and liver dysfunction. Also, we know that interstitial lung disease is one of the manifestations in Gaucher disease. So this also because of the accumulation of this material in lung, and of course in bone, and we have many bone manifestations, as we will discuss later. So this is why the disease is a multi-system disorder. Now, classification. The commonest type, what typically we see is like the common, or what we call it, the non-neuronopathic or non-neuropathic or type 1. In this condition, we have like the main manifestations are visceromegaly, hepatosplenomegaly, blood manifestations, thrombocytopenia and anemia, and bone manifestations. We don't have in neurological primary neurological manifestations. This is the commonest, with the prevalence is about 1 in 50,000. And the age is variable, can start early in life, from infancy to adulthood. Then we have 2 forms with neurological manifestations, Gaucher disease type 2 and type 3. These are very rare, incidence less than 1 in 100,000. The difference between type 2 and 3, type 2 is we can call it like acute, where manifestations appear early, typically during the first year of life, and it's rapidly progressive, and typically children die between the age 2 to 4. Now we have the other type, which is type 3, still age of onset is early childhood, but progression is slower, and they may survive longer. They may survive to adulthood. Now, the neurological manifestations vary. They can be like developmental delay, regression, bulbar signs, including difficulty swallowing and breathing, spasticity or pyramidal signs, oculomotor apraxia, nystagmus, seizures, myoclonic epilepsy, ataxia. So it has like really severe primary neurological conditions. But again, type 2 and 3 are very rare. So again, in this table, we can see like how like the prevalence about like the common type is type 1, 2, and 3 are rare. But still, please notice that, again, for type 1, any age, type 2 and 3, they appear earlier. Type 2, like during the first year of life. Type 3, early childhood. And type 3 is associated with longer survival. But visceromegaly, which is like hepatosplenomegaly, and hematological abnormalities are present in the 3 types. So even type 3, this is important because we will talk at the end of the presentation about the utility of enzyme replacement therapy in type 3. So in type 3, they have hepatosplenomegaly, neurological, hematological manifestations, and also like bone abnormalities. Okay, so let's talk about clinical manifestations, and we're talking mainly about type 1. So like 3 main systems that are affected, liver and spleen, or let's make it here. So we will talk first about a presentation during childhood, and then but typically schizophrenia. Yes, that's right. And in addition, then we have the skeletal manifestation or bone manifestations, where we can have like bone pain, osteopenia, osteonecrosis, joint collapse. So these are like the main 3 manifestations. So in the clinically, they present with marked hepatosplenomegaly, easy bruising because of the thrombocytopenia. They may also have a delayed growth retardation. In adults, like same, there's really more variable manifestations, but again, the same 3 main manifestations, like the hepatosplenomegaly, maybe like more than 80% of the cases, anemia, thrombocytopenia, and these will present as like easy fatigability and easy bruising and bleeding tendency with abdominal pain. And of course, we have like marked skeletal or bone abnormalities. We can have like a chronic bone pain or bone crisis, where we have like acute pain with sometimes with fever, with leukocytosis. It look like osteomyelitis, but it's like not osteomyelitis. It's called like pseudo osteomyelitis, where they have really severe bone pain. And of course, they can have osteopenia, fractures, joint collapse, so bone manifestations are really significant finding also. So here in this study, they looked at time of diagnosis. So at time of diagnosis, half of affected individuals, they have moderate hepatomegaly, which is like the liver is 1.25 to 2.5 times the normal. And same thing, like half of individuals, they have moderate splenomegaly. Now, the definition of moderate splenomegaly is little different. It's like between 5 to 15 times the normal. But also they can present with severe hepatomegaly or severe splenomegaly. Now, again, at time of diagnosis, 35% of individuals presented with anemia, and about half of individuals presented with moderate to severe thrombocytopenia, like severe less than 60 platelet in 14%, and moderate between 60 to 120 in 45%. Now, bone involvement. Now, we know that now the accumulation of the storage material in Gaucher cells will affect our organs, and this is what people think causes like the weakness and osteopenia and the bone problems, but the exact, the precise pathophysiology is not very well understood. And the issue with bone disease is that the extent and progression of bone involvement in Gaucher disease are very variable. And sometimes people don't complain and things progress without being noticed, and then they present with severe complications. And again, like it's right, like there is no really correlation between what type of mutation, like the genotype, and the extent of bone involvement. Okay, differential diagnosis. Two main differential diagnoses: other storage diseases, but also hematological malignancies. So if you look at it like, okay, bone pain and bruising because of thrombocytopenia, fatigue because of the anemia, hepatosplenomegaly, growth retardation, like all these features. Now, you first thing you will think about are malignancies, right? Leukemia, lymphoma, multiple myeloma, and this is true. They have like similar features, especially with other adult onset manifestations. And interestingly, they did like this survey, and 86% of patients with these complaints, they started by going to a hematologist or a hematology oncologist as first doctor. When they have these symptoms, they asked consultation, they went to hematology. Unfortunately, when we have another study, or in the same study, when they asked hematologists about, they gave them this scenario. They said, okay, let's say you have 42 adults with anemia, thrombocytopenia, hepatomegaly, splenomegaly, bone pain. What do you think of? Only 20% of hematologists put Gaucher disease in their differential diagnosis. So they were thinking about lymphoma, leukemia, multiple myeloma. So this is a really big problem. So they don't even think about Gaucher disease in the majority. So this is why it's really important to raise awareness about Gaucher disease. So now we know that if we don't treat Gaucher disease, we have really severe complications, like simply from bleeding. Bleeding can cause big problems. Interstitial lung disease can cause pulmonary hypertension, liver disease, sepsis, growth retardation, the complications from bones. And at the same time, we know that the treatment, enzyme replacement therapy, is efficacious and safe in preventing and reversing most of these complications, as we will see in the next few slides. So if we have thrombocytopenia, splenomegaly, and we don't have really good reason for that, we don't have, of course, we need to think about malignancies, but we excluded that. We excluded like the common things like hemolytic anemias, thalassemias, ITP. Then definitely we need to keep in mind Gaucher disease as a differential diagnosis. And the problem that if we have, unfortunately, like cases of really long delay and years delay in diagnosis. And diagnosis is very simple. Now, what we need to do is to take blood sample. Now, of course, we need to assess the enzyme activity. So yes, you can take a blood and do it for enzyme activity, enzyme assay for the acid beta glucosidase. But we can do a simpler thing. We can test the enzyme using filter paper. And if the filter paper is positive, like the enzyme is low in the filter, then we can confirm by doing a proper enzyme test, or better, to do genetic test. As you see from the table below, more than 99% of people with Gaucher disease, they have mutations in the gene. So this is what we do. We start with filter paper. If the enzyme is low, immediately we do genetic test to confirm the diagnosis. And the good thing that like as part of the support from Sanofi, they will sorry. Sorry? Yeah, you have the voice clear? Yeah, check. But we just need to make sure that the voice is good? Okay, good. Okay. So yeah, and the good thing about that, Sanofi will cover these tests. They arranged sending the samples to specific labs to do the enzyme activity, and at the same time also will, if it's positive, they will proceed and do the genetic test immediately from the same sample. So we have like a clear answer. Okay, now biomarkers. I mean, we can use biomarkers to help aiding in diagnosis, but they are more important for monitoring the treatment response. And as we said, like this is the ceramide. So the glucosyl ceramide is the substrate for the enzyme. So yes, glucosyl ceramide will be high. It's called GL1. But there is another minor substrate for the enzyme that is actually ceramide is composed of sphingosine and fatty acid. So if you remove the fatty acid, then you left with a sphingosine. So the other compound is called the glycosphingosine, which is lyso-GL1. This is also a substrate, a minor substrate for the enzyme, and is also elevated in Gaucher disease. So both elevated. However, the lyso-GL1 or glucosyl sphingosine is more specific for Gaucher disease, as we will see in the next slide here. See, now we have like the difference in here. We have the patients with Gaucher, and here the control. So this is for lyso-GL1. So there is really, we don't have overlap. So, but if you look at the glucosyl ceramide or GL1, yeah, there is some overlap between patients and control. So maybe you have patients with values that are close to or within the control range. So this is why lyso-GL1 is actually more suitable or more specific for Gaucher disease. Okay. So again, for diagnosis, it's very important to remember that yes, many patients will go to hematology or hematology oncology. This is why it's important to keep Gaucher disease in our mind when in the differential diagnosis, when we deal with leukemia or lymphoma, when we have like, especially if you have like splenomegaly or thrombocytopenia. And the diagnosis is very simple. We start with a dry blood spot to test the enzyme activity, and if it's positive, we can just immediately do the genetic test. Okay. So just a few slides about enzyme replacement therapy, and we will talk here about the imiglucerase. And now this is the first enzyme replacement therapy for storage diseases, and we have like data of more than 2 decades about the safety and efficacy. The doses are individualized, but it's relatively it's like, let's say, because it's like 1 to 2 hours once every 2 weeks. So it's many people can do that. But this is of course lifelong. it will improve, as I'll show you in the next slide, how enzyme replacement therapy improves all manifestations of Gaucher disease. Like, for example, here, this is like 8-year study. See how hemoglobin improved and platelet improved with enzyme replacement therapy. Then here, for example, the liver volume decreased, spleen volume decreased, bone mineral density increases, right? And the bone crisis reduced over in here. Also growth in children with Gaucher disease, how growth improved and with enzyme replacement therapy. In this study also, they looked at 6 parameters: hemoglobin, platelet, liver volume, spleen volume, bone pain, and bone crisis, and see like the percentages of improvement, like, for example, hemoglobin 90% improvement, and platelet 80%. Now this is over a period of 4 years. They also looked at these 6 markers together, and more than 90%, they have improvement in more than 4 markers. So they improved not only in one aspect, in multiple aspects. Same thing here, we look at reduction in spleen and liver size over a period of 5 years, like a dramatic improvement. Here we also looking at platelet count, how much it increased over a period also of 5 years, the improvement in hemoglobin and platelet count. Even here we have reduction in bone crisis and bone pain. For example, here from like bone pain 50% and then reduced to 30%. And final, here, bone mineral density, like over a period of 48 months, almost close to normal. And finally, reduction of avascular necrosis of about 50% with enzyme replacement therapy. Finally, if you remember, we mentioned initially that we have visceral and hematological manifestations in Gaucher disease type 3. And in Europe, it's the enzyme replacement therapy is used for type 3. We know it won't change the neurological outcome, but it will help in the hepatosplenomegaly, helping in blood manifestations. And this, of course, can result in better survival and better quality of life. Like in this study where they studied 8 patients with type 3, they have better quality of life measurements, better visceral and hematological manifestations. So in summary, Gaucher disease is the commonest, is the most common lysosomal storage disorder, and we know it's autosomal recessive disease, so we expect it to be higher in a population with high consanguinity. For type 1, the common type, we have really variable manifestations, variable age of onset, mainly with main manifestations, hepatosplenomegaly, blood manifestations, anemia, thrombocytopenia, and bone problems. Differential diagnosis in hematological malignancies. So we need to think about Gaucher when we think about hematological malignancies, and like especially if you have like splenomegaly, thrombocytopenia without a clear reason, definitely we need to consider Gaucher disease. Diagnosis is very simple. All what we need is dry blood spot. They will do the enzyme assay. If it's positive, they'll do genetic test. And early diagnosis and treatment are essential really to prevent and reverse complications. So I'd like to thank you. We thank Sanofi to support this event, and of course, Pierre, the event management that arranged all this. And I'd like really to take this opportunity to tell you about MENA Congress for Rare Diseases that will be held between 16 to 19 May 2024. It will be in Beach Rotana in Abu Dhabi. This is the largest event for rare disease in the whole region. We will have really 4 full days, more than 20 CME hours. We are expecting more than 120 speakers. We hope also expecting more than 1,000 participants. Please, this is the link, MENARareDiseases.com. And if you register using the code RARE, there will be really very special discount on registration fee. We already have like early bird registration still, so this will be an additional discount. Please, if you are interested in rare diseases, this is the right place, and the venue is amazing. Thank you very much, and we will take some questions now. Yes, please. Yes.
And the W or the you can refer cases to it, and the application available.
Yes, yes. So in UAE, the medication is available. Yes, we have 3 centers. In Abu Dhabi, we have Sheikh Khalifa Medical City. In Al Ain, we have Tawam Hospital. In Dubai, we have Al Jalila. But at the same time, of course, you can refer. But at the same time, if you have a child or adult and you are suspecting a Gaucher disease, you can send the test. Okay, so I will pass this question to Ali to help us. I mean, this is the question. If we suspect Gaucher disease, do we really need, because I mean, getting appointments with metabolic, of course, we will be happy to do that. But for pediatrics, different specialties, can they send the test directly, or it's better to refer and the specialty is like the metabolic person send the test? What do you say?
I said no. We have the option whether to refer direct to the metabolic or we can do the test from our side. My colleague here, she is not for the whole of the body and the range. She can provide you with the diagnostic test. And once you suspect about any case, actually she can create for your account, so you can receive the result later on. And with this service, diagnostic service that DEMA can provide, we will measure the enzyme level, so it's lower than normal. On the same paper, we can do the mutation test,
yes,
the genetic test, which will confirm for you whether this patient is positive or negative. If it's negative, okay, you can exclude it from your mind. If it's positive, the treatment will be available.
So a general registration, I can contact her personally. And in this case, accordingly do the test, and if it is positive, you will refer to each.
It's once it's confirmed,
yeah,
and you cannot forget that it is not eligible in the private.
Yeah.
In the government, you can
call it the clinic.
It's your
yes, yes, absolutely. And Dima, can I show our virtual attendees also?
Actually, we do the system that you're in Austria, and we are just provide the thing only. So once you call people, for example, she will arrange to do a courier, will come and to collect the sample and send it outside. You are not involved in the result, by the way. We know the result with the positive or negative from your side, by the way. We are not involved. Yes, we are making the risk.
Yes, yes. I mean, exactly. And the good thing, again, we emphasize again that, and I mentioned that in the presentation, but we'll say it again. We'll do enzyme assay, and we will go, if the enzyme is low, immediately the genetic test will be done. And this is for our virtual attendees. This is like, it's a simple filter paper where we put blood drops here and then keep it dry. And these are relatively stable, and then will be shipped to a lab in Europe. And enzyme test will be done on that, and also they can take DNA from the same drops for genetic testing. Yes. Oh, thank you. Sorry. Yeah, I had one line, but because I was rushing, I didn't have chance to say. No. For diagnosis, if you suspect Gaucher disease, no, you don't need to do bone marrow. You just do. Thank you. Yes. So this is the scenario. What happens? Yes, you suspect leukemia, you do bone marrow, and then you see Gaucher cells. In these cases, again, you go back and you need to confirm by enzyme assay and genetic test. But if I'm suspecting a Gaucher in this patient, no, I shouldn't like do bone marrow just to confirm. Yes. 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 Yes, I mean, sometimes it happens. Yes, we do bone marrow. People think about malignancies. They do bone marrow. They found Gaucher cell, and then go back and do the enzyme assay. Yes.
There is no effect. On the
Yes, I mean for type 2 because it's severely progressive and people don't survive, so it's not used. For type 3, yes, typically it's not. It's more for the visceral and hematological manifestations of Gaucher. Yeah, welcome. And maybe we can see if we have questions from our virtual attendees. Did you see real cases of this rare disease? Yes, of course. Of course, we have. We have, again, it's pan-ethnic, it's present in all societies, and we have several cases in United Arab Emirates, and they receive enzyme replacement therapy. Yes. Is the enzyme deficiency the main cause? Yes, this is the primary cause. We have mutation in the enzyme, and then we have enzyme deficiency, and this is why we have accumulation of the storage material in macrophages. Mariam Ismail, thank you. Thank you. Newborn screening for Gaucher disease. Yes, it's done in some areas. It's not part of a newborn screening in UAE and most and all the countries here. But yes, in some places, like some states in USA, yes, they screen for not only for Gaucher and for other lysosomal storage diseases. It can be done because it's like enzyme-based assay and it can be done on filter paper. And we hope that, yes, it will, with the expansion of newborn screening, that it will be included. Fatima Al-Kindi, any abnormalities on bone marrow of Gaucher disease that might give a clue? Yes. We were discussing if bone marrow is done to rule out malignancy, then you can see this is the macrophages filled with the storage material, what we call it Gaucher cells. Where is evaluation? And I think we were discussing that if you suspect a case, if you are in we can of course refer to a metabolic physician, but also you can do the enzyme assay, and if it's normal, then you exclude the diagnosis. A curative treatment. Let me be optimistic and let me say that enzyme replacement therapy for Gaucher disease is curative. Yes, I mean you don't. It's really amazing how this therapy improves the life. People with Gaucher who receive enzyme replacement therapy, they live like close to normal life. So yes, we consider that as a cure. Does ERT increase life expectancy? Of course, yes. Like treated versus untreated, yes, of course, because again complications are severe if untreated, and all this can be avoided or even reversed. Like if you look, we have like many images of like children with a huge hepatosplenomegaly before and then after treatment result. Maybe next time I will put like this famous picture of a child with extended abdomen and then after treatment just completely normal. Are there any severity grades in this disease? Yes, type 1 is actually it's amazing. Like Gaucher disease is a huge spectrum. You know, it can present prenatal with hydrops fetalis. This is one differential diagnosis of hydrops fetalis, and can present in adult with like thrombocytopenia, splenomegaly. So it's really wide. Like the manifestations are huge. This is why it's really important to keep a low, let's call it low index of suspicion and lower threshold of doing the test. Perfect. STEM take place in management. Like in general, in storage diseases, yes, people can use a bone marrow transplant or stem, like it's like mainly bone marrow transplant as source for the enzyme in general for many storage diseases. Okay, let's see. Any other questions? Okay, perfect. So I think I answered all the online and all the physical. And again, I'd like to thank Sanofi and Bill for this. And again, I'd like to remind you about the meeting. And we will soon send the invitation for January's the club, the meeting in January. It will be another topic related to rare diseases. And thank you very much. And مع السلامة. Bye.
Can do it too.
You can.